So you're trying to cut through all the noise, right? You want to really get to the heart of complex issues, but without feeling totally overwhelmed by, endless details.
Yeah, that's exactly what we aim for here.
We take a bunch of different sources, pull out the key knowledge, the stuff that really matters, basically giving you a shortcut to feeling well-informed.
And today, we're doing a deep dive into something really significant and honestly quite concerning in the U.S. It's the ongoing health disparities between Black and white Americans.
Yeah, a persistent problem.
Definitely. We've looked at quite a range of materials. Health reports, some analysis of equity in healthcare.
Right.
Also a study looking at mass incarceration and its link to public health, and another piece on population health, especially with rising income inequality.
So quite a few angles here. And I think the big question that just keeps bubbling up looking at all this is just why? Why has this been such a stubborn issue?
Exactly.
With all the medical breakthroughs, societal changes, why are these racial health gaps still so entrenched? Okay, let's try and unpack this.
Well, the first thing that really jumps out, I think, is just how long this has been going on. One of the reports, the Lippman Health Report, makes it pretty clear. Even with a century of, massive change socially, technologically, Black Americans have consistently had worse health outcomes and shorter lives than white Americans.
And those early numbers are just stark, like 1900 life expectancy.
Yeah.
Black individuals expected to live about 33 years. White individuals, almost 15 years longer.
15 years. It's a huge gap.
It really is.
And, okay, the gap has narrowed since the end of slavery, that's true. But the critical point, the real takeaway here is it never actually closed.
Right.
The report also mentions this concept of excess deaths, looking at Black Americans aged 0 to 79.
And that highlights it's not just something recent.
No, absolutely not.
Yeah.
It points to this long-term pattern,
Yeah.
of premature death. It's been happening for a long, long time.
But here's where it gets, more complex, right? Because it's not like nothing changed.
Well, that's a crucial point.
The Lippman report notes that for infectious diseases, things like flu, pneumonia, TB, even stuff like enteritis, those racial gaps did largely disappear, mostly between the early and late 20th century.
Exactly. And that shows that progress is possible, right?
Yeah.
We tackled those diseases more effectively across the board. But, and this is the troubling part, as those infectious disease disparities went down, new ones emerged, or existing ones got worse, particularly with chronic illnesses.
Like heart disease.
Cardiovascular disease, exactly. They became the main cause of death. And the racial disparity there just escalated. Think about this. 1920, the difference in CVD death rates, white women versus non-white women, was about 38 per 100,000.
Okay.
By 1950, it had jumped to 139 per 100,000.
Wow. So the nature of the disparity shifted and even intensified in some areas.
Precisely. That's the key takeaway. It wasn't static.
And this isn't just about adults either. Infant mortality is such a key indicator, and the report looks at that too.
Yeah, and it's a similar story in a way. Overall, infant mortality dropped massively for everyone, which is great news.
Huge improvements.
Huge. But the relative gap, the difference in likelihood of dying before age 1 between Black and white infants, that actually widened between 1915 and 2017.
Widened. So even as things got better overall.
The disadvantage for Black infants became, relatively speaking, more pronounced. In 1915, they were about 1.86 times more likely to die than white infants. By 2017, that was up to 2.2 times.
That really underscores how overall progress doesn't automatically lift all boats equally.
Exactly. Equality of outcome didn't follow overall improvement.
Okay, what about mental health? That's obviously a huge part of overall well-being.
It is. The report acknowledges the data. There can be a bit complex, mixed findings, especially for things like depression rates overall. But they do point to data, like from 2019, showing different levels of reported depressive symptoms across racial groups. So it's definitely part of this larger picture of unequal burden.
And the report makes another interesting point about Black immigrants often having better health than U.S.-born Black individuals.
Yeah, that's a really important nuance. It really makes you question looking at race purely as, these broad categories.
Right.
It strongly suggests that the specific lived experience of being Black in America, with its unique history and ongoing social context, is a massive factor in health. It's not just about some inherent biological grouping.
So, okay, it's clearly way beyond biology, which brings us to the roots of it all. The Lippman report really argues that these disparities fundamentally come down to power imbalances.
Yes, and racist social structures.
Yeah.
not innate differences.
It's tied into this idea of the political economy of health, right?
Exactly. It's a way of looking at how political choices, economic systems,
Hmm.
how they actually create and maintain inequality,
Yeah.
and then how that inequality directly impacts health. The report even brings up Friedrich Engels and his concept of social murder.
Which sounds intense, but it's basically linking economic power structures to these health outcomes.
Essentially, yes. Arguing that the conditions created by certain economic relations can predictably lead to worse health and shorter lives for certain groups.
The report also uses this term devitalization. What's that about?
It's an interesting concept. The idea is that living in areas with concentrated poverty, facing discrimination, that constant social stigma, it can erode a person's sense of self-worth, their agency.
Kind of a feeling of powerlessness.
Exactly. And that chronic stress, that feeling, can itself increase vulnerability to illness, maybe make it harder to engage in healthy behaviors, or even just access resources, like a vicious cycle.
It's almost like the system itself implies some lives are just less valuable. And the report suggests that this view actually makes it harder to even see the systemic unfairness that's causing the problems.
Right. And that connects to the work of Charles Mills, which the report references, his idea of the racial contract and what he called an epistemology of ignorance. It sounds academic, but the core idea is powerful. The system itself can produce a kind of structured ignorance or lack of understanding about the inequality it creates.
Especially among those who benefit from it.
Often, yes. And Mills argues this isn't just an accident. This blindness is actually functional. It helps keep the unequal system running.
Okay, so these power imbalances, the structural racism, how does it actually work on the ground? How does it translate into worse health? The report points strongly at housing and education.
Yes, as deeply interconnected systems. It argues that residential segregation, which is deeply entrenched and historically rooted in, frankly, racist ideas about property value.
Right, that race itself determined financial risk or desirability.
Exactly. That segregation systematically sorts people into neighborhoods with vastly different levels of access to resources. And education is a key one.
And this wasn't accidental. We're talking about specific policies, right? Like the New Deal housing programs being structured differently.
Two-tiered, yeah. And then post-World War II policies, even things like the GI Bill, which were meant to help, often ended up reinforcing segregation. Urban renewal projects, too, often displacing Black communities.
And redlining, that term comes up a lot.
It's a stark example. The Homeowners Loan Corporation, the HOLC, back in the 30s, they literally drew red lines on maps around certain neighborhoods, often Black neighborhoods.
Marking them as hazardous for loans.
Precisely. Based largely on race. The report stresses how this essentially codified the idea that race equals financial risk. It denied generations of Black families access to home ownership, which is a primary way of building wealth and stability in the U.S.
And the effects linger long after the practice was outlawed by the Fair Housing Act.
Absolutely. Decades of disinvestment have lasting consequences, and that segregation directly impacts schools.
Because schools are often funded locally based on property taxes.
Largely, yes. So segregated housing leads directly to segregated and unequally funded schools. This creates huge racial disparities in educational quality and attainment.
And there's a strong link between education level and health outcomes.
A very strong link. The report emphasizes it's not just about the diploma itself. The same power structures that create unequal education also affect how those educational credentials translate into health-relevant resources.
Like income.
Like income, definitely. The stats are clear. College grads earn significantly more. Median weekly earnings are like more than double those with less than a high school diploma.
And that extra income buys access to, well, things that keep you healthy.
Right. Better healthcare? Sure, but also healthier food, safer places to live and exercise, less exposure to environmental toxins. The report also touches on the decline of unions, which historically offered some protections, especially for workers without college degrees, impacting workplace safety and conditions too.
Okay, so housing and education are huge. Then the Littman report brings in another major institution, the criminal justice system, which might seem separate at first glance.
But it's not, according to the analysis in the report, particularly drawing on sociologist Loic Wacquant's work. The argument is that the criminal justice system is deeply intertwined with those racially segregated, under-resourced neighborhoods we just talked about. It functions, in part, as another mechanism of racial control.
How so? Through patterns of investment and disinvestment.
That's part of it. Decisions by cities, by private companies, about where to invest resources and where not to. It leads to neglected areas, often with more pollution, fewer amenities, where working-class Black families are concentrated. These areas then often become heavily policed.
And specific policies played a role too, right? The report mentions the war on drugs.
Yes, specifically the Anti-Drug Abuse Act of 1986. The huge disparity in sentencing for crack versus powder cocaine had a massively disproportionate impact on Black communities, fueling the rise of mass incarceration.
And this explosion of incarceration is directly linked to the health disparities we started with.
Yes, there's a growing body of research showing clear links. The report details the poor health conditions inside prisons and jails, inadequate health care, sanitation issues, violence, overcrowding.
Which we saw play out tragically with COVID-19 outbreaks.
Exactly. Higher rates of infectious disease are common.
But the report mentioned something kind of counterintuitive, a potential reduction in mortality risk for Black men while incarcerated. That sounds strange.
It does, and it's crucial to understand the context. The report is very clear. This isn't because prison health care is good.
Okay.
Instead, it might tragically reflect just how dangerous and resource-deprived the conditions can be in the highly segregated communities they often come from. It's a really grim comparison, suggesting that for some, prison might be marginally less immediately lethal than their home environment, which is
Yeah, that's incredibly sobering. And of course, the negative health impacts don't stop when someone is released.
not at all. The report highlights huge challenges for formerly incarcerated people. Difficulty getting health care, finding stable jobs, securing housing, plus the enormous weight of stigma and the stress of reentry.
And this doesn't just affect the individual, right? It spills over.
Absolutely. It impacts the health and stability of entire families and communities. There are significant spillover effects.
It's also pointed out that this stress, this awareness of the system, affects Black Americans broadly, even those who are highly educated and have never been incarcerated themselves.
Yes, the constant awareness of potential racial profiling, the risk of criminalization in everyday situations. The report argues that this creates a chronic stressor.
They use the example of Melody and Christian Cooper in Central Park.
Right. That incident really highlights the everyday burden, the constant vigilance required, and the potential for things to escalate dangerously based on racial bias. That takes a toll, mentally and physically.
So it paints a picture of these really deeply embedded interlocking systems. But the report also stresses that this hasn't gone unchallenged.
No, definitely not. That's a crucial part of the story. These systems of power have always faced resistance. The report credits the Black public sphere. Scholars often working from the margins, like W.E.B. Du Bois, plus social movements throughout history with generating crucial knowledge, challenging racism, and explaining these health inequities.
And the civil rights movement is maybe the most prominent example of that resistance having a real impact.
Absolutely. The report cites research showing that the collective action during that era, directly challenging institutional racism and those power imbalances, it led to measurable improvements in health.
Specifically mentioning the Civil Rights Act of 1964 and its positive impact on reducing infant mortality among Black Americans.
Exactly. It shows that when you challenge the structures, you can change the outcomes.
And things like the Fair Housing Act of 1968, while maybe not fully realized, held that same potential changing resource allocation could improve health.
Right. And this leads the report to advocate for what it calls a public health critical race praxis, meaning it's essential to incorporate insights about power, about racial political economy, drawn from social movements themselves, into how we analyze and address health inequality. The core message remains. These health disparities are a product of unequal power embedded in our institutions that control access to life-sustaining resources.
So, wrapping this deep dive up, the overwhelming conclusion is that these persistent health gaps aren't about individual failings or biology or just bad luck.
Not at all. They are deeply, deeply rooted in history and in ongoing structural problems, systemic inequities.
And understanding those roots, that complex interplay of power, housing, education, the justice system, that's absolutely vital if we actually want to create meaningful change.
It's the only way, really. You have to understand the cause to find the right cure.
And it really leaves you thinking, if challenging power imbalances, like during the civil rights movement, demonstrably led to progress, what are the most effective leverage points today? Where can we push to dismantle structural racism and finally achieve genuine health equity for everyone? Something to consider as we look at current efforts and hopefully a more just future.